Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Puberty from start to finish. What happens? Puberty refers to the time when a child's body goes through physical and emotional changes to become sexually mature. Changing hormone levels trigger the start of puberty and cause several physical changes. /r/n/r/n Children assigned male at birth experience a growing penis, body hair, and a deepening voice. Children assigned female at birth experience growing breasts, widening hips, and periods, menstruation. /r/n/r/n Puberty's meaning often needs to be understood or clarified. The average age to start puberty is between 10 and 14 for girls and 12 and 16 for boys. However, it is common for children, tweens, and adolescents to experience puberty before, early, or after, delayed. These average timeframes. /r/n/r/n This article will provide an overview of puberty, including the changes to expect, when they will occur, and when to see your healthcare provider. /r/n/r/n Puberty is a normal process for all kids to go through. This article will refer to people assigned male at birth as boys and people assigned female at birth as girls. People who are transgender or non-binary will also go through puberty. Verywell Health acknowledges that sex and gender-are related concepts, but they are not the same. /r/n/r/n Illustration by Mira Norian for Verywell Health. /r/n/r/n Puberty begins when a child's hormones begin to change. In a boy, the hormones trigger the testicles to make testosterone and sperm. In a girl, hormones trigger the ovaries to make estrogen and produce and release eggs. Children of all sexes can expect to experience skin changes such as acne and a growth spurt. /r/n/r/n During puberty, children with ovaries experience an increase in estrogen levels, and this can lead to several physical changes including /r/n/r/n Most girls experience a growth spurt about 1 to 2 years before their periods start. After the period starts, they can expect to grow another 1 to 2 inches in total. /r/n/r/n Children with testes experience an increase in testosterone levels during puberty, and this can lead to the following physical changes. /r/n/r/n Most boys experience a growth spurt between the ages of 12 to 15. By age 16, a boy's height will likely not change. However, the person can still gain muscle mass. /r/n/r/n Puberty often comes with emotional changes for all children and tweens. Possible emotional changes include :/r/n/r/n While it is common for people to experience strong emotions during puberty, it is important to note that children who feel sad or hopeless most of the time may have depression. If a child's mood or emotions seem to interfere with their daily lives, talk with your child's healthcare provider about possible mental health conditions. /r/n/r/n The average age to start puberty is between 8 and 13 for girls and 9 and 14 for boys. However, these time frames depend on various factors. /r/n/r/n Puberty starts when an area in the brain called the hypothalamus signals to the body that it is time to begin developing the external reproductive organs, as well as the breasts, skin, muscles, bones, hair, and brain. /r/n/r/n Early puberty occurs when a child begins to experience the physical changes of puberty at a younger age. Girls who start puberty before age 8 and boys who begin puberty before age 9 are considered to have early, precocious puberty. Most children who experience early puberty have a family history of parents going through early puberty as well. /r/n/r/n The two types of early puberty include /r/n/r/n Researchers are not certain why some children go through early puberty. Children with central precocious puberty, CPP, do not have a physical health problem that causes early hormonal changes, and the cause is usually unknown. /r/n/r/n early puberty is more common in girls than boys. Possible causes or risk factors may include /r/n/r/n boys who begin puberty after age 14 and girls who begin puberty after age 13 are considered to have delayed puberty. Many adolescents with delayed puberty have a family history of parents with delayed puberty. /r/n/r/n constitutional delayed puberty is the term for late puberty in healthy adolescents when the cause is unknown. This is the most common type of delayed puberty. /r/n/r/n boys may be diagnosed with delayed puberty if their penis and testicles do not start to grow by age 14. The child may also be shorter than many of their peers. /r/n/r/n girls may be diagnosed with delayed puberty if their breasts have not begun to develop by age 13. The first sign of puberty in most girls is the development of breast buds. /r/n/r/n delayed puberty in adolescents has several possible causes. Isolated gonadotropin deficiency, IGD, is a chronic condition that causes deficiencies in the hormones that start puberty, luteinizing hormone, LH, and follicle-stimulating hormone, FSH. This condition is present at birth and is usually diagnosed in infancy or childhood. /r/n/r/n chronic conditions that may cause late development in boys include /r/n/r/n a common cause of delayed puberty in girls is a lack of body fat. Girls who participate in competitive gymnastics, dance, or swimming may not have enough body fat to trigger puberty. Girls with certain chronic illnesses or eating disorders may also experience severely low body fat levels. Eating more and gaining weight can help puberty begin. /r/n/r/n a less common cause of delayed puberty in girls is primary ovarian insufficiency. This occurs when the ovaries are damaged or do not develop properly. The most common cause of primary ovarian insufficiency is Turner's syndrome, a genetic disorder that occurs when all or part of one X chromosome is missing. /r/n/r/n if puberty starts too early or is delayed, it is very important to discuss it with your provider. Those issues have the potential to be abnormal, and there may be a need to determine the reason for the delay or early onset with various blood tests and/or bone age X-rays. /r/n/r/n puberty involves several physical changes that tell you that your body is going through this process. If you are unsure if you have reached puberty, consider the following questions. /r/n/r/n girls may consider the following questions. /r/n/r/n boys may consider the following questions. /r/n/r/n puberty is a time when a child's or adolescent's body goes through several physical changes to become sexually mature. Hormonal changes trigger puberty and cause physical changes. /r/n/r/n in boys, an increase in testosterone leads to a larger penis and testes, a deepening voice, and muscle gain. In girls, an increase in estrogen leads to breast development, widening hips, and the start of menstrual periods. /r/n/r/n the average age of puberty for girls is 8 to 13 and 9 to 14 for boys. Many people will go through puberty before or after these average timeframes. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.